We're going to continue with Chapter 38, Part 2, Preparing the Child for Hospitalization. Let's talk about hospital preparation. Let's review pre-hospital counseling. As I'm discussing this, you may look at your textbook and see box 38-7 for guidelines for admission. You can decrease negative feelings of fear in children because the fear of the unknown often exceeds the fear of the known. It is based upon age, according to some research, and that children up to age 4 may benefit from receiving pre-hospital counseling 1 to 2 days prior to an anticipated procedure or admission. Ages 4 to 7 may be counseled upon up to a week in advance, and for older children, it may be beneficial to give them greater than a week to process the information, as it will allow them plenty of time to ask questions. Important issues to consider when preparing a child for an admission or a hospitalization is to prevent or minimize separation by encouraging parents to room in, minimize loss of control by allowing children to make appropriate choices, promote freedom of movement by allowing the child to move about the room or the unit as their condition allows. Remember about infection control. Maintain a child's routine by incorporating time for homework, snacks, naps, and etc. Encourage independence and industry as appropriate for age or developmental level. Prevent or minimize fear of bodily injury by providing the child with pre-procedure preparation. Provide developmentally appropriate activities. Provide age-appropriate diversional activities. And toys. Encourage parents to bring toys from home rather than buying all new as allowed per facility policy. This is especially important with toddlers. They benefit from having things that they are familiar with. Support family members, provide information, encourage parent participation, prepare for the discharge and home care. For school age, you want to help school age children adjust to being in the hospital. Explain hospital schedules such as meal times to the child, and attempt to arrange the child's schedule in the hospital to be similar to the schedule the child follows at home. For admission assessment, see box 38-5 of your textbook for nursing admission history according to the functional health patterns. Let's review some of the admission guidelines. For the room assignment, you want to make the room assignments according to age, gender, and diagnosis, and think about infection control. For the nurse assignment, a primary nurse should be assigned to oversee the care of the child during the child's hospital stay. The same nurses should be routinely assigned to care for this child to foster relationships between the child, parents, and nurses, as well as to encourage continuity of care. For introductions, the primary nurse should be responsible for introducing the child and family to the unit, as well as for introducing the child to new procedures, the schedule, and etc. For the rules and regulations, unit rules and regulations should be discussed with parents upon admission, including visiting rules, infection control policies, such as children in isolation not being able to play in the playroom or visit the social area. For the admission history, see pages 1113 to 1116 for a review of admission history. For the physical assessment order is not concrete when caring for children. When looking at developmental nursing tips, review this slide. There are developmental milestones. This is by 12 months of age. They review the physical, motor, cognitive thinking, language communication, social, and emotional, and then they show possible warning signs and typical developmental milestones. When reviewing developmental milestones 2 to 6 years of age, they look at the gross motor, the fine motor adaptive, the personal, social, the language, and cognitive. Review this table. When you take a look at roommate selection for adolescents, adolescents usually do better with one or more roommates. It is not a good choice to have an Alzheimer's patient or an infant as a roommate for an adolescent patient. Location of an adolescent's room is also important. Okay, let's take a look at the Pediatric Vitals. Pediatric vitals include weight, temperature, this could include rectal, oral, axillary, or tympanic membrane, pulse, the apical heart rate times 60 seconds is the best for young kids, respirations, blood pressure. Proper cuff size is important in order to obtain more accurate readings. Pulse oximetry. You may have to contact respiratory therapy to obtain the appropriate pulse oximetry probe. A standard probe will not work on infants. And pain. The pain scale, you need to make sure that you're using the age-appropriate pain scale. See handout titled Pediatric Vital Signs. This will give you parameters of what's considered normal vital signs. This concludes part 2 of Chapter 38.